Are you interested in cash pay physical therapy? Or maybe you're a physical therapist now who works in this setting and you're wondering, what is the future of this industry and what does that mean for you long term? Well, I'm here to help. My name is Garcia. I help cash-based physical therapists just like you improve clinical outcomes and thrive in business. When we look at the profession or the industry of cash-based physical therapy, there will be numerous changing in the next 1 or 2 years. And this is where it's important that you stay ahead of these things. Over the next few years, as we see declining reimbursements from insurance companies, you'll find two customers or two people exiting the insurance-based model. Number one is the patient. The patient won't want to be one of 6 people inside that room being treated by one person. They don't want to be treated by technicians or aides. Then you're going to have the physical therapist inside that same model saying, I don't want to treat 6 people an hour. So these people are going to be leaving that industry. What does that mean for you as a cash-based PT? The patients, you'll have more of them, which will be fantastic, but you'll eventually have to show how you're different than insurance-based care. Well, also those physical therapists who were treating inside insurance-based model will probably be trying to dabble in cash-based physical therapy. Now, if you currently have a business, no need to be concerned because these providers will be coming with the insurance-based model. They're going to try and dabble in cash-based physical therapy and it won't work because it's a completely different framework. And if you're a cash-based physical therapist now, you understand what I mean. It's not the same clinical skill, it's not the same process, and it's not the same patient or customer. Patients in insurance-based care, they're typically unmotivated. They really don't have high goals. They're not very active. They're not very compliant. And the ones who are seeking a new experience or a different process are the ones who are motivated, who want to be active, and the people that you want to serve. Now, if you're interested in cash-based physical therapy and you're wondering, gosh, I think it's pretty straightforward. I might want to try that. You're going to have to separate yourself amongst other people and other existing cash PTs. And the only way you're going to do that is by improving the 3 Ps inside your business. And that's the product, the process, and the person, understanding who that is. As we make this shift towards more people gearing towards cash-based physical therapy, you have to understand how does that support what your future holds. If you're a third-year physical therapist or brand new to this profession and you want to go in that direction, you have to understand that the insurance-based model and using that same standard framework will not work in a cash pay setting. If you're an existing owner, just know that you will have more cash pay patients coming your way. That is fantastic. You'll be there to catch them when they start to experience that they're a number inside an orthopedic mill. But the profession of physical therapy will begin to spiral, especially from an orthopedic standpoint. Why? Because we won't be able to deliver on that same quality of care. That's just the nature of what will happen. As that customer has to pay more, their insurance pays less, and now the orthopedic clinic inside is making less per patient. They will have to go with a higher volume. There will be no outlet in this entire process. You'll have to decide how that affects you inside your professional path, whether you're employed by that orthopedic clinic and you're not looking forward to treating 6 people, or you're currently a cash PT and you're excited about the future and how that's going to help you thrive in your local business. This is essentially what will be happening to the profession. It'll be more cash PTs out and about, some dabbling, some all in, and that might be just you. But just know, just because you try it won't mean you're successful. Ultimately, you'll have to understand the process of business and how you need to approach these individuals. As I mentioned, there's those 3 Ps, the people, the product, and the process. Most physical therapists early in their career will be obsessed with the product. How do I get more mobilization skills? How do I get my manual skills up? That won't be the solution long term. You'll get a couple patients on your schedule, but they won't stay long. Then you have to figure out how to get that process down. How do I then move them on to a wellness service? How do I go beyond pain? How do I improve their health? How do I improve their wellness? What do I need to do to help them build into a fitness program? All of those questions are process driven. It's not just learning more skills. You have to learn how to improve that process. And then the person, the actual people inside the business, which is going to be your customers. Do you truly understand what they're looking for in the solution that you need to be able to provide? Those 3 things will separate what your future looks like. So if you're interested in dabbling it, you better get great at those 3 Ps. If you're currently a cash-based physical therapist, be excited. There'll be more customers coming your way, but it still doesn't change. You have to improve your process and understanding of the customer. That's where long-term success will come in. I hope this improves your clinical approach and your future business.